This is Pindrop Media. As cases continue to mount in the US, and it seems as there's no end in sight, we must look to other countries to emulate their success with the coronavirus. As CNN put it, South Korea tops most coronavirus league tables, given its comprehensive system of testing, tracing, and isolating that kept infections relatively low. Germany, led by scientist Angela Merkel, also gets high marks. New Zealand's isolation can be a curse, but that combined with the quick shutdowns limited the spread of the disease. Today, though, we are going to look at an interesting story coming out of South Korea as a follow-up to its preventative measures. One of the first major outbreaks in South Korea began in Shincheonji Church of Jesus and spread rapidly undetected. Once confirmed, this caused a nationwide lockdown, including the said church, which handed over its list of attendees for contact tracing measures. Because of their stringent efforts, they nearly flatlined their curve, which is still currently only at 13,030 cases, with 232 deceased. This is such an amazing effort of cooperation by all of the citizens of South Korea, but their story does not stop there. Over 4,000 members who have survived COVID-19 from the heavily affected church are donating their convalescent plasma to the Green Cross Pharma in a display of gratitude to the government and health officials. Quote, at a time when plasma donations to the Korean Green Cross have been low, Shincheonji's church contribution is invaluable. With prices of plasma from biotech companies around the world ranging from $350 to $40,000 per milliliter, this sets Shincheonji's donation at a value of about $83 billion. To put this into perspective, 4,000 donations would equal 30% of their total confirmed cases in South Korea. In the US, that would be the equivalent of 845,286 donations and counting. These donations can work twofold. First off, as an immediate relief for those affected by COVID-19 through convalescent plasma transfusion, and in testing new vaccines and cures. The only way to determine the accuracy of a test is to run it against samples known to contain antibodies of COVID-19 and ones known to lack them. The FDA in the USA now requires diagnostic companies to run their tests against at least 30 positive samples and 75 negative samples to obtain emergency approval for the COVID-19 antibody tests. Even in the US, where cases are spiking, many drug manufacturers are also fighting to gather resources. In San Antonio on Wednesday, 13 people donated 40 units. A supply of 94 units were sent out to local hospitals, but officials with the South Texas Blood and Tissue say they still don't have enough to fill incoming requests. San Antonio currently has roughly 13,000 cases, almost the same as South Korea. Yet, finding an adequate number of donors is difficult, and demand is high. In addition to the expanded access program, clinical trials and research studies also require convalescent plasma, and drug manufacturers are collecting convalescent plasma to make COVID-19 immunoglobulin products, increasing the competition for this scarce resource. With members across the globe, Shincheonji's chairman Lee Man-hee invited his congregation to help fight the coronavirus in South Korea and around the world. Quote, I promise to cooperate for the benefit of humanity and the government's policy, and conferred with our church members so that the estimate 4,000 congregants who recovered from COVID-19 can provide their plasma to develop a good medicine to solve this infectious disease. Quote by Lee Man-hee. For those who want to donate or support in the US, Survivor Corps is a grassroots movement based in New York that are gathering together survivors and companies in need of plasma for testing and treatment purposes. Share this positive news and let's work together to heal the world. This is Pindrop Media.